tight schedule here, so I want to get underway. Greetings, everyone. The meeting of 9 a.m. the time of 9 a.m. has arrived, and I now call the House Health Committee to order. Today we have a joint informational meeting with the Committee on Aging and Older Adult Services on the Nurse Aide program. This program is overseen by 3 different departments which handle education, training, and registering. We know nurse aides are in short supply, and there are problems with both hiring and retaining nurse aides. This hearing is designed to help us understand how the program works and where areas might exist for improvement. We have a packed agenda and a full house today, so I will forego the usual introduction of members and move straight into testimony. First, let me recognize my co-chair, Chair Rapp of the Health Committee, Chair Madden, and Chair Menser from the Committee on Aging and Older Adults. I hope to keep us on task, and so in each panel 30 minutes. But first, let me recognize Chair Rapp for some opening remarks, and then Chair Madden.
Thank you, Chairman Frankel. I just want to thank my fellow chairman for facilitating this informational meeting, and I want to extend my appreciation to all the testifiers for being here today. We all know that nurses' aides are critical contributors to our healthcare workforce and serve most of our most vulnerable populations. And unfortunately, many candidates face unnecessary testing barriers. Has become very difficult for us as legislators to address these issues due to the disjointed structure and oversight of the nurse aide training program, where it's divided among 3 state agencies and an outside contractor. Pennsylvania is dealing with a very serious nurse staffing shortage issue. We cannot continue to allow qualified nurse aide candidates to get lost in a bureaucratic system as our nursing homes struggle to meet staffing demands. Therefore, I do look forward to learning more about the improvements we can make to ensure that CNAs have a clear pathway to employment in our Commonwealth. Thank you, Mr. Chairman.
Thank you, Chair Rapp. Chair Madden.
Thank you, Chairman Frankel. I'm pleased to be invited to this discussion about how we solve the critical shortage that we have in CNAs and how we expedite their testing and get them certified so we can start fully serving our seniors, our growing senior population. So I look forward to all of your testimony and walking away with some valuable information. Thank you.
Thank you, Chair Madden. Our first panel is made up of agencies who oversee different aspects of the nurse aide program: the Department of Education, Department of Health, and Department of Human Services, as well as the Department of State, which oversee licensure for many other practitioners working in long-term care facilities alongside nurses' aides. The first panel has Kimberly Barge and Megan Brandt from the Department of Human Services, Wendy Miller, Executive Secretary, State Board of Nursing, Judd Pittman, Director, Bureau of Career and Technical Education from the Department of Education, and Jean Parisi, Deputy Secretary of Quality Administration from the Department of Health. Welcome, testifiers. Unless you guys object, I will start in the order that I introduced you. Kimberly. Good morning.
Sorry, I'm a little short. Good morning. Thank you for having me today.
Just get closer to you. Yeah.
Does that work better? Is that better?
Yes.
Good morning. Thank you for having me here today. I am happy to answer any questions. I appreciate the opportunity to be here to support any information you need about the nurse aide training and competency evaluation program.
Okay. Wendy Miller.
Good morning. My name is Wendy Miller. I'm the Executive Secretary for the State Board of Nursing, and I'm here to answer any questions related to the State Board of Nursing.
And Mr. Pittman.
Good morning, Chair Frankel, Chair Rapp, Chair Madden, Chair Metzer. I'm here to answer any questions that the Pennsylvania Department of Education and the Bureau of Career and Technical Education can provide around the NATSEP program and the training arm of the nurse aide part of our role here with the Commonwealth.
And Ms. Parisi?
Good morning. I'm Jeannie Parisi. I'm the Deputy Secretary for Quality Assurance with the Department of Health, overseeing the Division of Nursing Care Facilities that monitors this program. And I'm also happy to answer any questions or provide any additional information that we can. Thank you.
Okay. I have testimony which I have personally not had a chance to review. If somebody wants to provide us an overview,
Yeah.
I think that would be helpful.
Yeah, I'll gladly.
Okay,
Leanne.
thank you.
Yeah. So I'm here to represent the Bureau of Career and Tech Ed and the Pennsylvania Department of Ed. Nurse aides here in the Commonwealth, as you know, play a critical role in our healthcare system. In addition to supporting nurses and other medical staff, they help to monitor patient care. They play a critical role in serving our most vulnerable aging population and ensure that they can age with dignity. The Federal Omnibus Budget Reconciliation Act of 1987 set forth the provisions for Medicare and Medicaid sections related to long-term care facilities. The provisions of OBRA apply to skilled nursing facilities certified through the Centers of Medicare and Medicaid to receive Medicaid and Medicare funding are intended to improve the quality care of residents in long-term care facilities, such as nursing homes. OBRA specifically addresses the training and deployment of nurse aides. In addition to setting the minimum nurse aide training requirements, the Act requires states to review and approve nurse aide training programs and maintain registry of trained nurse aides. Prior to the enactment of OBRA, there was no standard of training for nurse aides, nurse aide registry to indicate qualified individuals for employment in our long-term care facilities and take care of our most vulnerable aging population. So the three agencies have vital roles, each their own. The Pennsylvania Department of Health and Human Services is the state agency that has the sole responsibility for the administration of CMS, the Medical Assistance Program in the Commonwealth. However, from the outset, implementation of OBRA has been an interagency endeavor. Title 55 PA Code Chapter 1181 directs the Pennsylvania Department of Health to establish and maintain a nurse registry. In cooperation with DHS, it also charges the Pennsylvania Department of Education with establishing the Nurse Aide Training and Competency Evaluation Program, or NATSEP, what I referred to in the opening, in cooperation with the DHS. I'm going to grab a couple quick milestones, kind of lay out our role, and then share with you what you would like in the onset, which was some recommendations on how to improve. So in January 1989, PDE published the first application for review and approval of the Nurse Aide Training programs and began approving in March of '89. PDE partnered with Penn State to build out a teacher education workshop so that we could train nurses to become teachers and really dig into this work. In 1997, the Pennsylvania Nurse Aide Resident Abuse Prevention Act was enacted to require a criminal history of those that are caring for our most vulnerable aging population. And per that act, PD has the regulatory oversight of that. So I have a team members that regularly check FBI clearances and do all that good work to ensure that folks serving our most vulnerable are, have the appropriate resources and background to do so. And then in 2003, PD developed a model curriculum that includes minimum state competencies that must be taught by nurse aide training program for approval. That particular curriculum goes through cyclical updates and was last updated in 2017. So a quick status of where we are. PD has three essential roles in supporting the nurse aide training program. Our primary function is to review and approve nurse aide training programs to ensure that they meet that mandated curriculum standard, which is with regards to competencies, content, and hours. We ensure that the instructors are qualified and that the facilities have no disqualifying elements as a part of CMS deficiencies, and then in turn are eligible to host a NATSEP program. And those programs are materially ready to train with equipped classrooms and laboratories. So we really want to ensure that all of those facilities are providing the best resources for learners to learn. The department is also responsible for ensuring the compliance of the PA Nurse Resident Abuse Prevention and Training Act and providing a course for nurses to learn how to teach adults. in nurse aid training programs, which is a little bit different than teaching our youngest learners or our middle-aged learners or our high school learners. And then per OBRA, Pennsylvania may not approve a nurse aid training program for more than 2 years. So we have a cyclical updating process that is on an 8-quarter cycle. Currently, there are 175 approved training programs in Pennsylvania. PD reviews approximately 22 programs per cycle. So there, in the written testimony, there is a map of where those programs are. That map delineates the type of facility that offers those programs. Is it a career and technical education center? Is it a long-term care facility? And then the map also indicates where there's potential gaps in our training facility locations. So the counties that are highlighted in gray are those counties that currently don't have training facilities, either at a career and technical education school or a long-term care facility. Program approval does not always translate into net gains. So there are times when programs move off this registry as a result of deficiencies and other issues, and there are times that programs move on. So we could approve 22 programs, but there may be times that 22 programs exit out. So there is that back and forth. There are multiple charts in the testimony that share with you kind of the trends around this program approval, where programs are and where they're housed, and where those 175 programs are. So if you look at a little bit of the testimony around where the programs are, you're going to see that over time, we've had a decrease in the overall number of programs. We've decreased by about 100 programs across the Commonwealth. We've approved different types. It used to be that career and technical education centers were the main providers of the nurse aid training programs. You're going to see in the graphic that we provided that has changed and that gap is widening. It is now more long-term care facilities than career and technical education centers that are doing that training. And that's for a multitude of reasons. When we visit schools, the centers, they often talk about the burdensome paperwork and OBRA requirements. It's also a result of nurses are in high demand. And it's really hard to get a nurse to take a pay cut, to come to our centers, and then be a teacher to train these young people to go into this career. That is a real issue, and I hear that all across the Commonwealth when I visit the centers. Whereas on the other side, at the long-term care facilities, they can do that in-house training. They're training people with the minimum standards, but also socializing them to their particular environments, their particular training modules, their particular just location and the things that that organization likes to make part of their culture. So you're going to see that gap. In addition, there are facilities that aren't eligible for having a NATSEP program as a result of CMS deficiencies or other reasons that don't set them up for the success of providing one of those programs. So you'll see an additional graphic that looks at the total number of potential facilities, long-term care facilities, how many have been terminated from allowable use of providing a program, how many are pending that termination, how many have been waived by our sister agencies, and then how many are good to go that could be part of that process. So I'm going to transition a little bit to what you had asked on the outset, like what's some things that we can do to make this a little bit better? One of the things I do want to applaud the team here at PDE and within the Bureau. They have been working tirelessly with short staff. We're down 2 individuals to get caught up and make sure that we're on time with our training approvals. On average, we're turning them around in about 70 days. And we're currently caught up on the backlog of approvals that we were looking to do. So in an effort to leverage technology and remove obstacles to training, on May 1st of 2025, PDE announced a new policy guidelines for virtual delivery of the theory portion of the nurse aid training program. When virtual delivery was introduced as an option for NATSEP in 2021, programs had to operate in person for the first 2 years to ensure a firm grasp of course monitoring requirements, the reapproval before transitioning to the virtual delivery. The new guidelines change that. A burgeoning program is able to offer virtual coursework without having the 2-year the 2-year bedrock as the foundation of their program development. Other changes to the guidelines allow for the use of online training vendors, provided that Pennsylvania curriculum requirements are met, an asynchronous delivery. Before, it had to be a teacher, like live on Zoom or live on Teams, providing the delivery. Now it can be asynchronous. A young person or an upskilling adult or somebody that has families can do this at their own pace and still get into a really solid career in the healthcare profession. PD is receptive to concerns about new application approval times and the amount of documentation required for monitoring and reapproval. Last year, the department decided to migrate the application and monitoring process to an online platform. Currently, my team works across 5 databases. Everything is old school paper pushing, and we're really trying to accelerate those efficiencies through modernized tools. The tool is called the Integrated Monitoring System, used by other dictoriates within PDE, will be developed to support the NATSAP approval and monitoring. During the ideation and design process of this project, Career and Technical Education advisors identified several areas in which the application itself can be simplified and documents required for monitoring can be reduced. So not only are we trying to add efficiencies through technology, we're trying to reduce the burden on the applicants. Specifically, a market survey and tuition cost analysis will no longer be required of new applicants. Since the restriction on LBN teaching hours was lifted in 2022, daily teaching assignments are no longer needed for monitoring. Professional licensures for instructors and patient care surveys for facilities will no longer be requested, as these records are available on state websites. And we're trying to leverage those opportunities to do those desk audits. PDE advisors are optimistic that the online system will provide efficiencies, reduce application approval time, and enhance the monitoring process. We're also exploring one additional efficiency around the NATSAP training program. And that is to allow an organization that, like a long-term care facility that has multiple sites, to act as an umbrella organization. And that we would improve that umbrella organization in one application that would then serve, if they have 10 sites, serve those 10 sites, in an effort to bring efficiency to that process. Several stakeholders have proposed this, and PDE advisors and the team agree that the facilities operated under a corporate umbrella or a management family should be permitted to submit for approval of a single program that would include, as clinical sites, those facilities within the corporate family eligible to host NATSAP. So it wouldn't be skirting OBRA or any other the requirements of a localized facility to be eligible for NATSAP. It really just would reduce the burden of each one of those facilities putting forth their own program or putting forth their own application for a program. We've also talked with our industry partners around this, so parties expressing interest in the model include the Allied Services Foundation in Wilkes-Barre, LECOM in Erie, HCF Management, which is an Ohio-based organization but runs 17 facilities here in Pennsylvania. A consolidation of the training programs under an umbrella would also benefit in our approval process, and it would allow the department to realize the reduction in the number of quarterly reviews, reduce that number from 22 that our couple people need to do, reduce that down, add to efficiency time, turnover time, try to get that below the 70-day mark that we're using right now, and it would require advisors to alleviate some of the staffing challenges we have. Much like the Career and Technical Education Centers, it's really hard to get a nurse to want to come work at PDE and say, give up that really good salary and the work that they're doing for a state salary and the work that we're asking them to do. So it is a challenge when we're talking about the workforce challenges around this. And so in summary, we're really trying to lean in with our sister agencies around bringing efficiencies to the part of the program that we have our sphere of control over, and are working hard to realize the need for nurse aides in the workforce system.
Thank you, Mr. Pittman. Before I turn to members, any of the other testifiers have anything to add? All right, I'll turn to Representative Borowski has a question or a comment.
Yes, thank you, Chair Frankel and Chair Rapp and Chair Madden for hosting this hearing. Very timely. I will say that I have one of the Delaware County's nursing home in my district and interact with them regularly. So understanding that the CNA shortage is really impacting our nursing facilities. And so I'm interested to hear all of the information around the training and the things that you are doing in order to get more CNAs into the field. I'm just wondering, what are some of the challenges that you face around the training besides getting the nurses? And I understand that, getting the nurses to be the trainers, and I think that's something that exists even in our nursing schools, and I mean, it's definitely an issue across the board. But what are some of the challenges that are being faced due to some of the CMS staffing requirements? And what do you guys see when it comes to the number of people entering these programs? Like, are we keeping up with the demand? Because what I hear is I've got a nursing home that has 2 floors that can't open because they can't meet the CMS requirements for the nursing ratio for the CNAs. They've got nurses, but they don't have the CNAs. So kind of how's all that playing together, and how are you guys addressing that?
Yeah, I could start just by, to clarify that the CMS staffing ratios are not currently moving forward. It's Pennsylvania's staffing ratios that are having an impact. So I just wanted to clarify that. And then just, if I can speak a little bit about the Nurse Aide Registry and why it's required. The training prepares individuals to be eligible to be on the Nurse Aide Registry, but that's federally mandated, as was pointed out, for any CMS certified facilities that are receiving federal dollars. They're mandated to only hire nurse aides that are eligible on the Nurse Aide Registry. The Nurse Aide Registry is meant to ensure that qualified individuals are available, but it's also to make sure that any individuals that have had any history of substantiated abuse, neglect, or misappropriation of resident property are excluded from the list. So that's the purpose of the Nurse Aide Registry. While our nurse aides are not certified in Pennsylvania as they are in other states, they are expected to meet the same requirements to a large extent, those state standards, and to be tested for them. So the Department of Health is responsible for maintaining that registry, working in partnership with DHS and PDE to ensure that qualified individuals, yes, thank you, to ensure that qualified individuals can get on the list, and then we work with Credentia to maintain that list to make sure that we have, it's accurate. That's the most important thing for us. We currently have about 80,000 people that are active on the list, with about 1,300 that are ineligible, that have been identified for abuse, neglect, misappropriation of funds. And this year we added about 11,000 people to the list, partially through training and testing, but also through reciprocal arrangements with other states. We're also responsible, the Department of Health, for managing the contract with Credentia. Even though there are components that are managed by DHS and PDE, we have the overall ownership of that contract.
Representative Gleim.
Actually, my questions are for you. I've been working on this issue, actually, with Senator Judy Ward ever since I came into office in 2019. Carlisle High School had their own program in-house and found it really difficult to actually find an RN to come in. The RN has to be in the building in order to train, the CNAs, and we didn't understand why an LPN couldn't come in and train. And we worked on this, and we actually got a letter from PDE under the Wolf administration that said an LPN could train a CNA. But because it wasn't changed in statute, they didn't want to do it because they were afraid that the program wouldn't be viable. So under my notes, it says that an LPN basically has to have an LPN who are currently approved as assistant NATCEP instructors in a post-secondary adult training program, and the LPN's RN supervisor must meet the new guidelines and will require a PDE-approved report of change prior to teaching the entire program in a training environment. However, all new RNs and LPN instructors and the LPN's RN supervisors must provide evidence of at least 2 years of nursing employment. That includes at least 1 year, minimum 2,000 hours of paid work experience in a licensed long-term care. I don't understand why, if they both have the same evidence of, work experience, why an LPN couldn't teach the CNAs without an RN in the building. So that's my question.
I guess we're sharing the mic on this. Yeah. So I'm loose on a little bit loose on the overall understanding of the question that you had. But what I can lean in on a little bit is I think we're definitely looking at those flexibilities. I don't know exactly how it connects to the federal regulation and OBRA, and if there's requirements in OBRA that supersede what we're doing at the state level around the registered nurse versus the LPN. The ultimate goal for us is to ensure that we're meeting the federal requirements. If there are conditions or barriers that we have put forth in our policy interpretation or in state statute, I think that's something that we would be willing to work with any of the representatives on to try to make sure to fix that. The virtual training element and the opportunity to have a vendor come in and do the instructional part of it does open up a little bit more for schools. And I think your question and Representative Borowski's question is similar in the sense that these are entry-level careers, and the more that we can get our career and technical education and high school spaces to offer these opportunities as a gateway for a young person that's interested in the health professions to get their feet wet, do some really good work, and then have a vertical trajectory. Because that's one of the things we've been talking about too, is really ensuring that our high school learners understand that there isn't just a ceiling to this, that they could move from the CNA to other elements of healthcare if they so choose. So I think both what you're saying is opening up the instructor opportunities, which we're open to. I think there are more. We just had our first school in a couple years reach out that wanted to open a program. And so we definitely want to put conditions in place that enable more schools to offer it, because it is a great opportunity for young folks to lean into a healthcare career and then really chart their course forward from there. So I think we can take that back, take a deep dive, and ensure that there's clarity around if the credentials are similar, is there something in the federal regulation that's prohibiting it? Is it something at the state level that we can ignite change around? But we're very open to working with anyone to make sure that happens.
Thank you, Mr. Chairman. I just want to let you know that the program was canceled because they couldn't get an RN to come in physically to the building, and I think that's such a shame. So I would hope that we could fix that. I mean, I can give you all the documentation. I'm sure Senator Ward could as well. Thank you.
Thank you, Representative Gleim. Chair Madden.
Thank you, Chairman Frankel, and thank you all for testifying here today. Since you brought up Credentia, I did have the opportunity to go over some of the testimony last night before I got here, and my questions are around Credentia. Some of the testimony that we're going to hear after you, and some of the concerns that I've been hearing as the chairwoman of Aging and Older Adult Services is that there's a lack of reliable testing sites. There are lack of reliable appointments being kept, that folks who have appointments to be tested travel miles and miles and miles, and then they get there, and the person who's to test them and certify them doesn't show up. So our agencies who are trying to fill, these positions are concerned that there isn't enough oversight of Credentia, that there aren't enough reliable testing sites, and there aren't enough testing sites to begin with. So I would really appreciate it if you all would, whoever it applies to would address that for me.
Yes, I can speak to that. I mean, currently, Credentia is on a directed corrective action plan that was developed and agreed to at the beginning of this month with each of the state agencies. The Department of Human Services and PDE were involved in developing that. We became aware of increased concerns back in November. They gave us a plan of remediation at that time, but in February, we were still getting complaints, so we required a corrective action plan. We had a couple of submissions that were not acceptable, and then finally a meeting in early May that will dictate a lot of what needs to be done within a 6-week period now. I think the last due date is June 30th. So we have heard those concerns as well, and we do expect that Credentia is going to come into compliance by the end of June.
And so, as we're trying to fill these positions, you're saying that we are going to have more testing sites, they're going to be more reliable, and we're going to be able to train and get these people tested and get them into our nursing homes and long-term care facilities and fill these vacancies, which are causing, I don't have to tell anybody in this room, the mantra is by 2030, 60-year-olds will outnumber 20-year-olds, right? And we have to rise to this growing concern. And I'm appreciative of Representative Glime's enlightening comments, and really encouraged to work with all of you and all of our long-term care facilities and the agencies to correct this problem so we can take care of our seniors. Thank you.
Thanks, Chair Madden. Chair Menser.
Thank you, Chair Frankel. So I understood from your comments that you're trying to consolidate facilities. Was that correct?
We are trying to provide an opportunity for the umbrella organization to put in one application for review. And if they have 22 sites, then instead of all 22 sites applying under that same umbrella organization for approval, that it would be one organization. So if we would take the LMO organization from Erie, if they have 22 sites, corporate would put in an application for a NATSEP training program instead of each of those 22 sites putting in an application.
So how many students can be taught in one location?
I'd have to get back to you on that. I think it depends on size of the facility and ratio of student to teacher, and then
Is there a ratio to student to teacher?
I would imagine yes. Yes.
Okay. Thank you.
Thank you. Representative Nelson.
Thank you, Chairs. I appreciate all the work in putting this hearing together. And I wanted to follow up. In Westmoreland County, we have, there you are, have a similar situation, as Representative Borowski has, where our county facility is only about half full because of the ratio issue. And you had clarified that the driver behind this is a state-mandated ratio. Can you touch on and help me explain because I think it's the application of the window of the ratio. Pennsylvania is requiring a per shift ratio versus a per day ratio, which would, at night when patients are sleeping, there may be an opportunity for lower staffing, but in the day, why couldn't we look at a full day ratio, which would still provide good, professional to client contact, but not be as crushing to the facilities that are really maybe even facing closure because they can't maintain their operating costs?
So our staff ratios, we use shift ratios as well as a per day ratio. So it's a combination of both. And while I wasn't here when those ratios were developed, my understanding is that there was a lot of consensus on some back and forth maybe, but consensus on what those ratios were per shift. And there is a difference between the overnight shift and the day shift. I do think that it's a challenge, the ratios for facilities, and we do hear the complaints as well. I think that there are, what we have found, and I don't have those statistics in front of me today, but what we have found is that the majority of facilities are complying, and there are some that are continuing to struggle for different reasons. We do accept exception requests. We've offered very few, only 2 or 3 exceptions have we given, because a lot of it, what we're looking at is it's a challenge, right? But I think the ratio per day that was landed on from research was 4.1, and our patient per day is 3.2 maybe. The quality that having adequate staff brings on board is evidenced by the data that we have. What we see repeatedly is that facilities that are meeting those ratios have less significant deficiencies.
I think the application or the modeling of the federal ratio, because yet facilities have to meet those ratios, and so that is preventing the alternative of now we have licensed beds that aren't able to be used, and that's forcing seniors to stay for days in the hallways of hospitals, and if we apply in a more balanced manner to, we're not saying we want to do away with ratios, but provide those ratios that is more in concert with the providers and their ability to be able to staff. Because with my understanding, the requirement to bring on those higher trained workers, if there's a gap, then those beds are going unfilled, and seniors are, they're in hallways for days.
There is a balance there, and I think one of our concerns is that, the staff ratios is meant to ensure that there are adequate staff to serve the number of residents that are in the facility. And that, there's almost a critical mass that you get to. If you have 100 empty beds, then you have to hire, 10 to 15 nurse aides. And you may have trouble finding those 10 to 15 nurse aides, depending on your area and the timing. But do we really want you to be serving those 100 people without the 10 to 15 nurse aides? I can understand where sometimes it's just at the tipping point and they may have to wait before they hire that next nurse aide. But, what we're seeing in general, it's roughly 10%. And I know, there's some debate on this, and we need to collect more data. But our concern is that we want to make sure that if somebody goes into a nursing facility, they're getting that quality of care. And there are some special circumstances where you may find in a rural community that it's a challenge. We have one facility that is the only facility in the county, and they have been cited repeatedly for staffing violations, but they've also been cited repeatedly for other deficiencies within the facility, and that gives us concern.
Thank you. I have three other members who have questions, but I do want to provide an opportunity again, because I know there was prepared testimony. We are under some time constraints, but those representing other agencies engaged in this, if you could summarize your testimony, if you so like to do that. All right, thanks. Appreciate it.
Kimberly Barge from DHS. Just waiting for my opportunity, didn't want to chime in. So DHS's role as part of the contract with Credentia is overseeing and managing the testing administration, which I will summarize quickly. You're probably well aware of some of the issues and concerns we've had with getting timely testing or for aides having to travel distances to get to testing. All of those concerns since the fall when we became aware, we've been collaborating with facilities, test centers, the trade associations, as well as the vendor to develop solutions and efficiencies with how that's managed. A lot of those elements are part of the directed cap that we're working with Credentia on, such as hiring more nurse aide evaluators to ensure there are skills events. Making sure there's more skills events with enough open seats for candidates to be able to test timely and within the required travel distance within our contract. That way we don't have folks going from Pittsburgh to Philadelphia to test. One of the opportunities for improvement that we're exploring and assessing, which also CMS is assessing, is the possibility of virtual skills testing for nurse aides, which as opposed to going to a test site to do that skills hands-on testing, they would still have to go to the test site, but the nurse evaluator would be, assessing virtually. It would be videoed. So those are one of the opportunities for improvement we're working on, looking, towards in the future, in addition to the directed cap and the contractual remediations that we have in place. So I kept it short and sweet.
Thank you.
Hopefully that gave you enough in addition to the testimony.
Either of the other testifiers who?
Yeah, I think I've actually
I know,
covered some of my
I
highlights
agree.
just in answering
Okay,
questions.
so-
Mhm.
Well, before I get to the other question, is there any discussion about kind of consolidating, responsibility on this issue, into one agency?
It precedes my time here. I'm not really sure why it was divided amongst the three.
But it just would occur to me that it maybe having a more coordinated approach.
I can speak to that. Yeah.
So it is a little unique that 3 agencies are involved in this oversight and process, but we all have very unique roles and responsibilities, and there is direct collaboration. Any part of the program, we are working together concurrently. All of our meetings and oversight activities are done jointly together with program level staff, and that works very well. That's not where we're seeing really barriers or issues to the program. It's, post-COVID, workforce shortages, nurses for evaluators, whether it be for training. Those are the types of areas where we're struggling and looking at future opportunities for improvement, such as virtual delivery, virtual testing, in order to create efficiencies, because with those virtual type programs, you could operate with less registered nurses, which we struggle to get into these positions.
Since you brought it up, what would need to, changes would need required to make virtual testing possible and training?
Well, we actually, virtual testing, it will be under our role. I think Judd already touched on the virtual delivery of training. We would have to, structure a program. We'd have to make sure there's quality oversight, that the video and evaluation, we maintain the integrity of that evaluation and skills exam to make sure those nurse aides do have those competency skills before they're placed on the registry. So there have been, our vendor may speak to it, there have been pilot programs and things in other states, which we are learning from and seeking to explore how we can deliver that. And based on recent CMS conversations, I believe they are in discussions with their general counsel to potentially put out some guidance and parameters related to that in the future.
Well, thank you. Yeah, Chair Rapp has a follow-up question.
Yes, it is concerning that everything is under, multiple agencies. So I, just following up really with Representative Frankel. So what are your thoughts on moving the CNA oversight under this, for example, the State Board of Nursing? Other states have done this. Have there been any discussions about this kind of proposal? And would you be supportive of this change? Are there any concerns that we should potentially consider? It just seems, I know you all have memorandum of understanding in your roles, but it just seems that it would be much more efficient if maybe it was under one agency or under the State Board of Nursing.
I don't know if anybody wants to speak to that or you want me to.
I just wanted to clarify that the CNAs are not CNAs in Pennsylvania, they're nurse aides. They don't become certified as they do in other states. And I think that that's part of the reason why the three agencies oversee that program rather than the Department of State, because it's not a certification program like it is in other states.
Okay, thank you. Thank you, Mr. Chairman.
Thank you, Chair Rapp. I have Representative Rossi.
Thank you, Chairman. In the Department of Human Services written testimony, it states that the Department of Health holds the contract with Credentia and is responsible for the nurse aid registry. However, in testimony provided to a Senate committee hearing in 2022 regarding temporary nurse aid training, there was testimony that the Department of Human Services holds that contract. When did it change from DHS to DOH, and why did that change occur?
It never did. I think there was a typo or miscommunication in what was being translated.
Okay, thank you.
Yep.
And some providers who have applied for their facility to serve as a regional testing site have had their applications go unanswered. I find that really concerning. Which agency oversees the processing of these applications, and what is the process for granting that approval?
So were you talking about them being an actual test site?
Yes.
That is the responsibility of the vendor, Credentia, who can speak to that later in their testimony. And I understand that they have made improvements as part of corrective action in order to more timely address those. And I believe they are up to date now with processing those.
So you are aware that those applications aren't being answered?
We became aware that there was a concern with that.
And how long has that been?
That was more recent, we became aware, and that's part of the directed plan of correction. But as far as how timely they're responding to them, that would be a question we can have the vendor speak to when they're on the panel to really explain that process.
Okay, and are there testing dates, times, and locations posted anywhere? How do they know about when these are available?
The vendor can probably give a better in and out of their system, but there's a platform called CNA 365, an electronic platform managed by the vendor, where candidates would go in to do a search and search for events within a certain radius, or for their, if a specific test site that they were looking for. That's how they would access those sites.
And do you know how many people can attend? Is it limited? Is it anyone who wants to come can get in?
It depends on the test site and the event, the potential volume of seats available. It could be space, location, those kind of things. But the vendor can explain the parameters within the system when they're on the panel.
Okay,
That may give you better.
thank you. I would hope that Credentia could be held to higher standards and that they're held accountable for their lack of doing their job. So, thank you.
Thank you. We have two folks who haven't asked questions at this point, and then we'll move on because we have a full agenda. I've got Representative Brown, Representative Krupa. Okay, Representative Krupa then, and then I think we need to move on because we still have three panels, and we also want to get to Credentia, which is the last panel. So thank you. Representative Krupa.
Thank you, Mr. Chair, and I want to thank all the chairmen and women for organizing this and for the staff. This is a very important issue. I represent the 51st House District, which is southern Fayette County, so my entire southern border is the West Virginia line. My mother, who lives in my district, who's my constituent, is a registered nurse who teaches CNA classes in West Virginia, so I'll do my best to recruit her to move north. But a couple different questions, and I'm just going to throw them all out there, and you can answer them in whatever order you want. But so thank you for bringing up the fact that the CNA, the certification that is happening in other states is not happening in Pennsylvania. So can you explain that difference, and should we be moving towards that? What's the benefits of doing a true certification process? And I know in conversations with my mother, and hopefully this is not a thing in Pennsylvania, but in West Virginia, she provides these classes through her administrative position in a nursing home. And what was really odd to me was that if that nursing home then has an issue with a particular, whether it's a survey or some other issue that's completely unrelated to the CNA classes, it has the ability to suspend those CNA, the ability to host those CNA classes for a year or more, which is really devastating and seems inappropriate given the lack of CNA classes. And this is not a Pennsylvania thing, right? It's nationwide. So if you could expand on, should we be looking more towards that certification process? And as the process stands in Pennsylvania, is it hurting these classes if it's tied somehow in with other things that the nursing home may be doing? Thank you.
So regarding certification or not, we'd have to look at that more carefully. I just think it's important not to keep referring to them as certified when they're not. And it could be a potential career ladder step if they were certified, and seen as a career ladder step if it were. But more than that, I think we'd have to do some research. Regarding losing the opportunity to continue to be a training site, that's a federal requirement, and we really have no flexibility when it comes to that. And I think the premise behind that is that if you're not operating a quality facility yourself, should you really be training nurse aides to work in other facilities?
Thank you for the panelists. Appreciate your coming and informing us. I'm going to move on to our next panel on facilities. We have Zach Schamberg from President and CEO of Pennsylvania Healthcare Association, and Austin Colley, the Director of Legislative Affairs for Leading Edge PA. Say, Lisa, sorry about that. Just got to get.
For sure.
Good morning, welcome. Zach, I'll
Good
turn
morning.
it over to you.
Thanks. Mr. Chairman, Chairwoman Madden, thank you for granting me the opportunity to testify this morning. You know, I just want to make one point before I get into my testimony. The idea of staffing ratios was brought up quite a bit, whether it was from your questions or it was raised from the Department of Health. And yes, our organizations back in 2021 and 2022 did support higher staffing. Today, we support higher staffing, leading to quality care across the state of Pennsylvania. But I just want to give you one example. Last week, we have a member in Western PA who had a gentleman who was serving as an LPN on the night shift. He had to leave his shift because his wife was going into labor to deliver their first child. So at 2 a.m., he left the facility and went to see his wife give birth. The Department of Health walked in and cited that facility for not meeting the ratios. We support higher staffing, but we don't support that. We support flexibility. We support quality care, but we don't support that type of egregious enforcement. And I think that's what needs to be looked at very seriously, especially in the face of testing challenges as we're about to outline. Again, I'm Zach Schamberg. I'm the president of PHCA, the Pennsylvania Healthcare Association. We represent long-term care across the Commonwealth, including government-run, nonprofit and for-profit nursing homes, as well as personal care homes and assisted living communities. To put it very simply, as it's been stated already, Pennsylvania is facing a healthcare workforce crisis, and that should come as no surprise to you. But it's especially alarming for our long-term care continuum and their residents, as our senior demographic is the fastest growing in the entire state. And as the chairwoman pointed out, Pennsylvania today has the 5th highest population of older adults in the country. And demand for long-term care is very quickly outpacing supply, especially in the face of facility closures, sales, changes of ownership, and reorganizations. Now, there are beds available in nursing homes, sure, but today, providers simply can't staff them. In 2022, there was a national survey of nurses conducted, which revealed at that time that 1 in 4 nurses were planning to leave the profession within the next 4 years. 1 in 4 were going to leave. And at that time, the median age of a registered nurse in the United States was 46 years old. So the question is, has anything changed since then? And I would argue no. In fact, especially in Pennsylvania, it's gotten worse. Earlier this year, we published our own survey in conjunction with Leading Age PA and the Hospital Association, which revealed those same workforce challenges are creating an access to care crisis in the Commonwealth. Based on that survey, 1 in 5 nursing homes in Pennsylvania have 21 or more open positions. More than half of all nursing homes are relying on agency staff to fill those positions or shifts. Agency, let me be clear, is not good for continuity or quality of care. Additionally, providers are being forced to limit admissions, defer facility improvements, place residents on wait lists, close entire facility wings or floors, or eliminate essential services, all because of a workforce shortage. I think the most alarming statistic of that entire survey was that 77% of our providers told us they can't find enough qualified individuals. So wages and benefits are certainly important factors. And yes, this work is not easy, but 3 out of 4 providers in the Commonwealth told us there are not enough qualified nursing staff in Pennsylvania today. Simply put, we are failing our aging population. And as any long-term care provider or prospective caregiver would likely tell you, and as you've heard already based on the questions this morning, it is extremely challenging to become a nurse aide here in Pennsylvania because the competency exam, which must be passed in order to work in a facility, is shockingly inaccessible. There are countless examples, as the chairwoman noted, of prospective nurse aide candidates who were forced to drive hours across the state to take a test, only to find out the test had just been canceled, or to find out that their instructor didn't bother to show up, or to learn that the next available test wouldn't be held for another 6 months, which bypasses the 120-day window they have to get tested. This is not uncommon. In that joint workforce survey that I mentioned, 71% of nursing homes said there are not enough local testing sites or timely testing appointments available. 45% reported testing sites canceling tests at the last minute. Many of these issues are, unfortunately, as you noted, tied to Credentia, the state's contractor that is in charge of providing testing and certification to prospective nurse aides. And keep in mind, very few prospective nurse aides actually go back and reschedule their test. Our members have been very clear. Due to these barriers, caregivers don't waste their time. They simply look elsewhere. Why fight against bureaucratic hurdle after bureaucratic hurdle when you can find a job at Wawa or Sheetz and start tomorrow? These barriers are turning away caregivers that we can't afford to lose, and we have to work together to implement effective solutions. We've talked a little bit about online virtual skills testing. That would reduce travel. It would mitigate scheduling issues, and it would make this a more efficient, cost-effective model. The state of Georgia, for instance, has a certified nursing assistant virtual skills evaluation program through the University of Georgia. We recently spoke with the Department of Human Services about this program, and over the course of our conversations, it sounds like Georgia will actually step in and support a pilot virtual skills evaluation here in Pennsylvania. That's a great step. And that is a step that we should take. Also, we were thrilled to see the Department of Education recently eliminate that requirement that a facility provide 2 years of in-person instruction before utilizing virtual instruction. Now, providers can apply for it right away, and again, that's a big step. As you've noted already, we do not believe that Credentia and this program needs to be overseen by the Department of Education and the Department of Human Services and the Department of Health. 3 different departments. As you can imagine, this only leads to confusion and inefficiency. And as it's been noted, other states have adopted a model in which this program is overseen by one office within one department. And as I've talked to my colleagues across the country, it works. And we should adopt that program here. As far as Credentia goes, and again, it's been noted, we have to hold them accountable. We should require transparency. We should require regularly scheduled reports that include quality and process improvement, and we included specifics of those recommendations in our written testimony. I would also note we testified before the State Senate in 2022 on what a disaster the nurse aide training program was through Credentia at that time. And you heard it today. The Department of Health heard concerns loud and clear in November, yet the corrective active action plan only started this month. On behalf of our nursing home members, the nursing homes that I represent, we cannot wait weeks or months for a corrective action plan. We need action today. Finally, I want to note that the legislature can act on this as well. And within the next few weeks, we hope that the state Senate will advance and send to you Senate Bill 114, legislation that will modernize nurse aide training by establishing a uniform statewide training program and allow for prospective nurses to challenge the CNA exam right away. And additionally, I would be remiss if I didn't mention Chairwoman Madden's bill, House Bill 1310, which would address the budget adjustment factor for nursing home reimbursement and make sure more funding actually gets to providers so that they can support the caregivers in their facilities. As the June 30th state budget deadline nears, we believe it's imperative that House Bill 1310 become a priority for the Commonwealth. A few weeks ago, you may have seen PHCA standing with SEIU Healthcare PA, where we announced a strategic partnership and an alliance aimed at building our long-term care workforce. We have been proud to partner with SEIU, with Leading Age PA, and many of you on these important initiatives because it's going to take partnerships like these to be successful. Thanks for your support, and thanks again for the opportunity to testify.
Thanks, Zach. Austin?
Good morning. Chairs Frankel, Rapp, Madden, Menser, and other members of the House Health and Aging Services Committees. Leading HP is grateful for the opportunity today to highlight the process in which aging service providers recruit, train, and retain certified nurse aides, CNAs, or also known as nurse aides, which are a keystone in aging services workforce. I am Austin Cawley. I'm the Legislative Director for Leading HPA. Leading HPA's membership is comprised of 420 providers, 175 of which are skilled nursing communities. 29 solely administer CNA training programs, and many others have partnerships with post-secondary institutions. Certified nurse aides assist individuals with activities of daily living, personal care needs such as bathing, dressing, exercising, lift and repositioning of residents, along with administering unmedicated remedies. They also make connections with these residents. Doing the care that they do, they learn the residents, how they act, what they like. They become part of residents every day. And for many residents, it's the best part of their day. It is federally required that certified nurse aide training be 75 total hours and include 16 hours of supervised practical training prior to any resident interaction. A portion must include hands-on clinical training, and that training program must cover topics which include communications and interpersonal skills, resident rights, care for the cognitively impaired, and restorative services. If an individual is hired, already employed, or becomes employed within a year of their training, the training is solely covered by the provider. If the nurse aide has not completed an approved training program and passed their nurse aide exam, they are prohibited from working a period longer than 4 months in a skilled nursing facility. Nurse aide instructors must go through a train the trainer course before they are certified as trainers by the state, and instructors are federally required to have experience in caring for older adults. Much of the work instructors do is teaching, but as was mentioned earlier, that a lot of it is the paperwork and the administrative burden that obviously takes a huge toll on those LPNs and RNs that have full-time positions caring for our older adults. Once the training program is complete, the state's exam contractor is notified and their eligibility to take the exam. And the exam consists of 2 portions, a written and a skills demonstration. Under state rules, a nursing aide instructor cannot serve as the exam proctor, and the community cannot serve as the exam location. This is allowable under federal rules. Upon successful completion of the examination, the individual is placed on the state nurse aide registry and is required to renew their standing on the registry every 24 months. Leading HPA was proud that PHCA and the Hospital Association partnered with us on a joint workforce survey showing the alarming need to address our workforce crisis, and that has some great data that I'd like to share with you all. By 2032, we will need an estimated 11,000 certified nurse aides to replace the workers exiting our workforce. Of providers surveyed, there's an immediate need of 1,700 certified nurse aides to fill vacancies and be able to remove caps on admissions. And more than 14,000 CNAs have left the industry on our state's nurse aide registry over the last 4 years. Ensuring that providers, training institutions, direct care workers, and state agencies have a clear, user-friendly system on which to build our next generation of direct care workers is critical. That is why Leading HPA is supportive of Senate Bill 114, which would establish a number of efficiencies and measures around nurse aide training. Those efficiencies include allowing a provider community to serve as the exam location and the program trainer as the proctor for the exam. Under the current system, providers and direct care workers struggle to find exam locations, as mentioned, often traveling hours outside of their region and to the nearest location. The bill also allows nursing students to use previous experience as a prerequisite for the Certified Nurse Aide Training Program and be eligible to sit for the CNA exam. A change that had been previously allowed, but now PDE policy forbids. It establishes a standardized curriculum for nurse aide training. Training providers must submit to PDE and have their curriculum approved right now. But having a standard state curriculum could help cut time it takes to approve programs, a process that our members cite nearly takes 9 months to approve. We appreciate Senator Dave Argo's leadership in introducing that comprehensive workforce package to build a true pipeline for a long-term care workforce. And we encourage support of the proposal once hopefully it gets over to the House. We appreciate the committee's interest in exploring CNA training and how improvements can be made, but it should not be ignored that there are 2 main issues as to why and the struggles our workforce is going through, and that is insufficient funding and state staffing regulations. That is why Leading HPA supports setting a 0.90 BAF floor, which is in legislation that Chairwoman Madden has introduced, and that sets a 0.90 floor to our state's budget adjustment factor, which would bring sustainability and predictability for providers' reimbursement. Furthermore, Leading HPA has urged the Pennsylvania Department of Health to provide relief and needed flexibility on how the staffing standards are administered. I'd like to briefly highlight the efforts Leading HPA is specifically making to promote careers in aging services and supports to our direct care workers. Our career growth partnerships are a collection of 9 colleges and universities, as well as 1 cyber charter school, and they advance our admission by offering accessible learning through discounts and scholarships for our members. professional development scholarships for any member employees ready to take the next step on their career path, and our public awareness campaign, Careers to Love PA, raises the visibility of aging services sector and highlights the wide range of career possibilities. It also helps educate students and job seekers about the many fulfilling roles available in our field and the required training and education that is needed, and an example of what that career path can look like. Leading HPA is also appreciative of efforts the General Assembly has made to improve our workforce, and that includes targeted investments as well as enacting certified medication aid legislation last session, which helps build a career ladder for our certified nurse aides in our communities. Once again, we thank the committee for their interest and attention to these important issues. Leading HPA and our mission-driven providers are excited to work with the General Assembly on what's ahead in aging services.
Thank you both. Appreciate it. Before I get to members, are there regional disparities in your ability to hire? Regional disparities, I mean, in terms of...
No, I'll speak for Pennsylvania Healthcare Association. No, it doesn't matter where you are, where you're located, geographic area of Pennsylvania, everybody's having challenges. And we thought for sure, again, given the higher ratios, given the workforce challenges, that maybe Philadelphia and Allegheny counties would be okay. No, it's not the case. Rural Pennsylvania is struggling just as mightily as urban Pennsylvania.
Thank you. Okay. Members? Representative Gleim?
Thank you, Mr. Chairman. Mr. Schamberg, you mentioned in your testimony about available beds. Can you tell the panel how difficult it is to get a bed transfer approval from DHS?
Bed transfer approval? We've had a couple members undertake that process. It takes weeks, if not months. There's a lot of back and forth and communication. Typically, the Pennsylvania Healthcare Association is asked to get involved, and we do. There haven't been numerous examples that I can give you, but from what we've seen, it's been quite difficult to get that transfer done.
Yes, thank you very much.
Representative Torzek.
Thank you, Mr. Chairman. Thank you for your testimony again and the care you give to our elders. But would you support putting a program under the State Board of Nursing?
The nurse aid training specifically, is that what you're asking? Yes, we would. We would support any initiative that brings that process and that training program under one office, under one department. If you wanted to put it in labor and industry, if you wanted to put it in education, health, human services, it wouldn't matter. State Board of Nursing, it wouldn't matter. If we can make it a more efficient process, and if we can have one person or one team in charge of it, I think that's better for everyone, especially the residents of Pennsylvania.
Okay, thank you very much. That's something we need to look into, because 9 months is certainly too long to get to this.
Chair, Madam.
Thank you, Chairman, and thank you, gentlemen, for testifying. I want to talk about the healthcare crisis and the fact that since 2019, we've closed approximately 30 nursing homes. And I'd like you to elaborate on what you think the reasons are, and we are talking about the budget adjustment factor. And what does PHCA think we need to do beyond the BAF and to work with Medicaid and to make sure that we cannot lose another nursing home? We have to fill these shifts. We have to have beds. And nursing homes can't have empty beds because of our bureaucratic problem.
Well said, Chairwoman. And I agree that this is a crisis. We have had 30 nursing home closures since 2019. I think even more alarming than that are the sales and the reorganizations and the changes of ownership. Again, that's not good for the vulnerable residents in nursing homes across this state. That's not good for continuity of care. The number one reason that nursing homes are closing in Pennsylvania and across the country is Medicaid reimbursement, plain and simple. And I think that issue is heightened even more from what's happening now in Washington, D.C., as Congress looks to potentially make cuts to Medicaid in some way, shape, or form, or cost shift and move money around, which will put a strain on this year's state budget. You asked what can we do beyond the budget adjustment factor. I think that is the critical first step, allowing, as Austin noted, predictability and sustainability for providers, ensuring that more and more funding that you allocate is actually directed to the providers themselves. But I also think it's more than a one-year fix. And like we do with K through 12 education, like we do with transportation. We need to make long-term care, and more specifically, the seniors of Pennsylvania, a priority in this state. This needs to be something that we invest in year after year after year, given our aging population. It can't be an increase here and we walk away and address it again in 10 years. Our aging population, as you noted, is booming, and at the same time, nursing homes are closing. This has to be a priority year after year after year in the Commonwealth.
Thank you. And I just want to echo how traumatic it is, right? When a nursing home closes. We lost Mountain View Care Center in Scranton a few months ago, and residents found out the day of, hey, guess what? We're closing and you're moving here. Right? And through testimony and as the chair of aging, I'm hearing this over and over and over again, that our nursing homes are in crisis and that they're closing. And you're correct. Where do we put our seniors? So thank you for your testimony. And I'm dedicated to this being a long-term investment and taking care of our seniors, as I am a senior. Thank you.
Thank you, Chair Madden, as am I. Chair Rapp.
Thank you, Mr. Chairman. Do you find that rural areas in Pennsylvania are more negatively affected with these issues that we've been talking about today? Then I know you mentioned that Philadelphia and Pittsburgh also have their problems, but do you believe that rural Pennsylvania is even more heavily impacted?
Absolutely. I think they certainly struggle to recruit. If they don't have that population, they can't recruit those workers into those facilities.
And I know you've commented quite a bit about the nurse ratios.
Yeah.
I did not support the nurse ratios, as you know, because it was my opinion at the time, and now I think we're seeing it very clear, that the nurses are not there to hire. And within your fiscal code, that you were able to negotiate with the administration, there were still penalties involved regarding facilities not having the ratios, which I think has been quite detrimental to skilled nursing facilities, especially in rural Pennsylvania, where, yes, we do struggle a lot more than Pittsburgh and Philly in being able to hire those, whether it's nurses or NAs or whatever staff needs to be hired. I know that when I was listening to the budget hearings, it was asked whether or not the administration was actually implementing penalties for facilities not having the ratios. And at that time, I believe the answer was, we're trying to hold off. We haven't implemented any penalties. Obviously, they kind of caught wind that, these nurse ratios don't work. I think it's lofty, and I think communities, career and technical schools, are all of our, facilities, our education institutions, we're trying to educate as many people as possible into the medical field. We know there's a huge shortage. But I think it's going to take a long time to actually meet nurse ratios. And it's still there because you were instrumental in getting it in the fiscal code when it wasn't passed by the legislature. And I think we're seeing the fallout of that. And it'd be nice to say, if we put more dollars into the system, it's going to fix it. If we get testing sites available, it's going to fix it. If we, put everything under, another entity, it's going to fix it. But I don't see that fixing nurse ratios when they're not there, or staff ratios. I apologize, it's staff ratios. Under the current situation that we're in, and I think we can also say, when you said it's potentially that we might not see those Medicaid dollars. And on the other hand, potentially we shall at the end of the day. So I just want to put that out there. But I don't know what the answers are legislatively. I know that there's a lot of concerns, and we don't have all the answers. So I think somebody already asked about the, which was also asked of the other panel, the putting oversight to the State Board of Nursing. Both of you would support that?
Yeah, I believe that's what the state of Maryland as well as other states do. And again, it works there. It would certainly work here, we believe.
Okay.
I just think any single agency overseeing this program is a lot better than three.
Okay.
Too many cooks in the kitchen.
And just when I talked about the staff ratios, I did have we have people in my office from 9 in the morning till session or caucus. So I'm sure Chairman Frankel does too. And so the questions usually are about Medicaid, but I specifically remember an administrator of a nursing home from Western Pennsylvania coming in and speaking with us. Although there's many issues, the one factor that is hurting that facility the most is staff ratios. So I ask you, to consider that, and especially since you are obviously very successful in what you do as far as working with the administration. But that's my input and today and as we go forward. So thank you.
Is it okay if I respond to just a couple points, Chairwoman? So first of all, you asked about rural versus urban differences, and I agree. Rural areas, this is more acute, given that nursing homes are maybe tens of miles, if not 100 miles away. So if a nursing home can't find staff and they don't have available beds, we've heard numerous instances where family members are having to take their loved one an hour, 2 hours, or 3 hours away just to find care. There are counties in this state where there are 3 or 4 nursing homes and all have either closed or are currently up for sale. That's a problem. I talked about agency staff, and again, we don't support agency for continuity or quality of care. In rural areas, it's much harder to find agency staff, so again, you're more likely to see that cap on admissions. So a facility may only use half or 70% of their beds, and then again, the question is, where do those potential residents go? How far do they have to travel, or do they even have to travel out of state? And we've seen numerous examples of that. On the staffing ratios, in October of last year, we sent a letter to the Department of Health asking for a formal moratorium on the staffing ratios, saying that we should maintain the higher overall staffing minimum, but put a moratorium on the ratios, bring stakeholders, including us, back together, and let's figure out a better path forward. Because when we came to this conclusion and we came to this agreement back in 2021 and 2022, I don't think we could have anticipated that the full-time workforce hasn't come back or wouldn't come back. And again, we find ourselves where nursing homes across the state cannot meet these ratios, shift to shift to shift. And so all we're asking for is a chance to come back to the table and figure out a better path forward, again, for quality care.
I appreciate the fact that you are taking another look at that issue. I appreciate hearing about the letter. I don't know that I've heard about that before, but I definitely think there needs to be discussions. And obviously, I know what was projected to happen with people returning to work. We all know that didn't happen. It's obvious. So I appreciate you sharing that with us, and I'm hopeful that there will be some reconsiderations. Thank you.
Thank you, Chair Rapp, and thank you both for helping shed the light on the urgency of addressing the issue. I'm going to turn to our third panel. We've got about a little less than 40 minutes to go. So Cesar Nieves, I hope I pronounced that right, and Wayne Reich. Cesar Nieves is a CNA from Allentown, and Wayne Reich is the CEO of the Pennsylvania State Nurses Association. Good morning, and I'll turn to you first, since you're first on the list.
I'm sorry. Let me start by saying good morning, and I thank you for taking time for listening to me. My name is Cesar Nieves. I've been a nurse's aide for 23 years. So recently I got promoted to a med tech, so I've been there for 4 years. I want to talk about I'm the frontline person, and I want to talk about so you guys could see what we're going through. CNA, like they were just talking about, we're short of staff a lot, and a lot of times we are asked to stay, and sometimes we get mandated to stay, and it's a burden. It's a hard burden. It's emotional distress, and it creates problems with the atmosphere in the facility. So, and a lot of times we do get new hires to come in, and a lot of them see that it's not for them, so they leave. Some people that I worked with left 4 years into the facility. They left because they heard somewhere else has a less ratio and more pay. So that's where we're at now with the nursing home. The problem is keeping staff. And I, for one, I just worked 16 hours, and they asked me to work another 12 hours to stay to 3 in the morning, which I absolutely couldn't do it because I have a long drive to come here to be present in front of you guys. I love my people. I love my residents. They become part of our families. A lot of them outlived their families. A lot of them were never married, never had children. So that being said, my thing is that I want to make sure that they are cared for, that they're safe, because everyone here have parents that you would like them to have 100% care, okay, and 100% that they're adequately taken care of, okay. So, and that's what we want. But how are we going to do it with the short staff? It's getting a little bit too overwhelming, and a lot of people are leaving the industry. I have an LPN who just left. He came back 4 or 5 months ago, and he said he's a truck driver now. He says he doesn't have to deal with this stress. So it's just him in the road. So that being said, it's a problem. It's a problem with the facility of nursing home industry. So we need to see if we could find a way to entice people to, hey, this is a good career. And I think that the wages is a little bit of a problem because of the hike of the costs of living, and everybody just can't afford it. Some people go and get another job or Wawa because it's less stress. They'd rather do that than working 15, 16, 20 hours, in the same level of stress, and that's leaving these elderlies wondering, when am I going to be next? I'm soiled. Not that we neglect them, not whatsoever. It's because we have 18 people to take care of one person. Mind you, when we had the COVID-19, that was a horrific time for us, and that's when we started losing a lot of people. Nurses was walking out, and people were scared. But after that, the ratio of people that's working to becoming a CNA or nursing has dropped a lot, because of they're hearing that it's a stressful job and stuff like that. So again, I love my people. I love my coworkers. I take care of them. I pretty much got adopted by 3 of them, so it's great. So like once in a while when I'm off, I come and bring them McDonald's, even though they may not need it, but I sneak it in, because I look at them as my parents or my grandparents and stuff. So it's hard for me, and it's hard for all the CNAs, nurses as well. Geriatric doctors too as well. So it's pretty, it's overwhelming.
Thank you, Mr. Nieves, and thank you for making the effort to be here and for everything you're doing. Really appreciate that. Thank you.
Thank you.
Sir?
Hello, my name is Wayne Reich, and I'm a registered nurse, and I serve as the Chief Executive Officer of the Pennsylvania State Nurses Association. You have my written testimony, so I hope you don't mind if my remarks differ. PSNA doesn't represent CNAs. We don't have them as members, but we feel that they are a vital part of the healthcare team. And we deeply respect the essential role that they play. This topic came up to us and became more of an issue to us about a year ago when the medication technician language was coming through. And it turned out the more I learned about CNAs in the state of Pennsylvania, the less I knew. So as we already talked about today, one of the problems is access to the education, access to the testing. I think everyone who has spoken today has agreed to that. The third thing that we're looking at is the oversight. 3 different departments, which one does which? That's hard to know. I just found out today, I've been a nurse for 22 years, that we don't have CNAs in the state of Pennsylvania. That's news to me. I didn't realize that they're not certified nurse aides. The other thing I want to point out is that of all the testifiers, they're all heads of agencies. They all represent companies, but we had one person who is actually working the bedside. And I hope that everyone on the committee listened and heard what he said, because we need to know why these people are leaving. And when we talk about ratios and we talk about staffing, what I don't hear happen is the results of why nurses leave or why nurse aides are leaving. And I think that's a vital rule, because we can give 1,000 more of each tomorrow, but if they're not staying, that's the problem. We're hemorrhaging healthcare workers, and we need to know why they're leaving. I heard earlier that we lost 14,000 nurse aides over the last 4 years. Why did they leave? Did we ask them? When I hear surveys come out from these hospital associations and these other associations, what I hear is what managers are saying why they left, what administrators are saying why they left. Let's ask them why they left. Now, that's vastly different from what I meant to talk about today, but it was a topic that I heard repeatedly. So I just wanted to address that. Now back to the departments of oversight. Too many departments. It's hard to, and I'm sure they do the best that they can, but it is hard for different departments to communicate with each other. So PSNA does support this moving under the State Board of Nursing. Other states have this model. We believe that it would create accountability. It would create regulatory process. The State Board of Nursing already approves nursing education programs. They have a lot of educators, and they already have experience in that oversight. I'm willing to take any questions. Thank you.
Thank you. Members, questions? Yes, Chair Madden.
I don't actually have a question. I just want to say thank you,
Oh, you're welcome.
Cesar, for your work, for your dedication, for your decades of dedication to seniors and sticking in there when it became really difficult. My son is a police officer in New York, and he has to work 3 12 to 14-hour shifts And I know how difficult that is. And when you're going from one bed to the next and you have 18 patients. And I just want to tell you that I'm familiar with Phoebe Home, as my husband is a musician who plays there, Roy Ramos. Yes.
Yes.
Yes. And you all make it look really good. When I walk into Phoebe Home, it's beautiful, and everybody has a smile on their face. And whatever your shortages are, you are working twice as hard to make sure that Phoebe Home is a wonderful, beautiful place for folks to live. And so I just wanted to say, we do hear you. We understand why you're leaving, and thank you for staying.
Thank you, Chair Madden. Representative Nelson.
Thank you, Mr. Chair. And my question is in two parts, two different areas in the area of workforce. And I really appreciate your testimony and your connection that you have with the patients and having loved ones in facilities. You know, there is this balance where ratios are important, because if there's not enough, you know, your soiled example, or somebody attempts to get up and go to the bathroom on their own and then they fall, and then that just creates a big string of dominoes. In the area of workforce, you know, personal frustration, state of Pennsylvania has been waiving work requirements for able-bodied adults without children since COVID, which is about 150,000, most of them younger men, that they're no longer required even to work 20 hours a week in order for them to receive their benefits. If we could tap in to these people and let them see your passion about the connection with seniors and in that community, is there a workforce development opportunity that we can get some of these folks that are currently just on the couch maybe plugged into your community for workforce development training?
Yes. Advertisement. We have a person that does work for that particular part. We ask them every Wednesday. We have a management and employees meeting, and what are we doing? What are you doing to entice people? And so they're working on that. You know, advertisement, pay rate. They're actually having new hires are getting 3 extra. Vacation to start off. Instead of 10, they're getting 13 days right off the back. So they did raise up the bar a little bit with the money, but it's whether they come in. It's not like they don't come in. They come in. It's just that they realize it's harder than what they thought it was going to be, you know, and it's just sticking it out. It's just having it in the heart. Mm-hmm. Okay, that's where it starts. It's just if you have a good heart and you know you love people, and my callings. I've been a supervisor for UPS 13 years. So this is not my calling. So my calling for 23 years is to be with elderlies or people that is disabled, to take care of them and show compassion. And a lot of them may need spiritual guidance, and I'm there for them for the spiritual guidance.
Yeah, I think if we have the opportunity, if that large segment of population was, you know, required to meet the federal work requirement of 20 hours a week, and they knew they needed to get plugged into someplace, it might be an opportunity to realize how rewarding that field can be. The second part of the question, again, in another area, is following up on, there was a Millersville study that was released earlier in May, and it was about workforce safety. And in there, they talked about, particularly in our senior facilities, the benefit of lifting devices, the number of back injuries that are occurring, and they recommended about $4 million of, like, the ability for facilities to be able to purchase equipment to better handle adults. Can you touch on I know that's different but that's an injured workforce is a challenge to the workforce, and you know, is there validity from your perspective that handling, lifting, moving could be improved?
we know that healthcare workers have the same injuries as construction workers. So if you throw up an X-ray of a healthcare worker and a construction worker, it's hard for physicians to tell the difference between who is who. So yes, we do support any type of assistive equipment that can help our workforce better move and work with patients in a safe, effective way. Your first question, PSNA supports a variety of different recruitment techniques. But again, what we're seeing is, I'm going to presume that we're of a certain age. When we got into the field and we realized how hard it was our generation to keep doing that. We still do it because that's what we did. Now, I only lasted 10 years, but nurse for 25. But what we're finding is younger people are not doing that. They're coming into these professions, seeing how hard they are, and they're leaving. We're seeing that in nursing, where they don't care about their student loans. They're leaving the profession altogether. And I'm certain that's happening too at the nurse aide level as well. It is a hard job, and I don't want to say it's thankless because we get a lot of reward from patients, but other things in place are that. So I still think we have to look at retaining too and finding out why our workforce is leaving.
Thank you. Chairman, Chair Rapp.
Thank you, Mr. Chairman. Gentlemen, thank you for being here. I think most of us, who've had parents or family members who've been in skilled nursing know and certainly appreciate the dedication of the staff and any person who lives in a nursing facilities. It takes, and it's obvious that the people who are employed there are very dedicated and caring and compassionate people. And I think they're very much appreciated by family and the residents themselves for the care that's given. Because I know that in many cases, it seems to me that when somebody's a resident, they either have family visiting all the time or family that's never there. So the staff really does become their family. So I appreciate everything that you do in your positions. I did want to ask you, though, that so starting July of 2023, the ratio is 1 NA per 12 residents on day and evening shifts and 1 NA per 20 residents of night shift. So are you saying that the staffing ratios that were negotiated as part of a budget agreement in 2022, that they're not working, we still can't get, people into the positions? And I understand what you're saying, sir. They're going elsewhere where they can make more money. There's not near the stress of the job. So in your experience, what was promised that, people would become and flood back into the nursing careers, they didn't as a result of the mandated ratios. We're still seeing, and we know we're still seeing major shortages as much as the educational system, our career and technical, my county career and technical has a medical program, and I just think it's wonderful. But we're still not able to get those NAs or anybody else in the medical profession to the point where we need it to be, and it's still going to take a while, no matter what we do legislatively.
Thank you, Chair Rapp, and I want to thank both of you for your testimony. It's I think, very important to put a human face on what we're talking about in terms of the work that you do for our seniors in our communities. And thank you for being here, especially Mr. Nieves for making this effort.
Thank you.
It sounded like it was.
Thank you for having me here.
And prioritizing this testimony was very important, and we really appreciate it. Yeah. So with that, I'm going to move on to our final testifier, as we have about a little less than 20 minutes. Credentia, Senior Director of Client Relations, Brenda Scafuro?
Yes, correct.
Hi, Brenda.
Hello. So I know that we are short on time and that you are short on time. So you have my testimony. I wanted to kind of just address some of the items that we've heard throughout this entire meeting, if that's okay, if I can start there.
Sure.
Okay. So as mentioned, my name is Brenda Scafuro. I am the Senior Director of Client Relations here at Credentia. And so as I've heard everyone speaking, the main things that I have heard are about testing availability. So let me start there. So one of the questions that was asked is there somewhere where testing availability is published or shown on some type of public forum? So I want to just explain how that process works. So when the candidates go in to schedule their exam, they are mapped basically by their address. So the system knows, our system knows, how many testing events are available, where they're located in relation to the candidate, and how many seats there are. And so when the candidate goes in and they go to schedule their exam and they want to schedule a skill exam, that's the button they push, and they want to see what is available within a radius, and it will provide them with a list of locations, and the candidates can choose from whichever location they would like to pick from. Because it is a live and living system and that's consistently changed, meaning the number of candidates that are scheduling into an exam at any given time does not allow it to be published publicly, because it changes constantly. So at the time that the candidate goes in and checks in to schedule an event, it shows in real time what is available at that moment. And then once that seat is taken, they've paid for their exam, that slot is no longer available. And when the next candidate comes in, there's one less seat available for them. So I just wanted to explain that process and how the scheduling piece works. One of the things that I also heard was about regional test sites not being approved timely. There was a ownership change and a system change. We enhanced a lot of our systems to both comply with security standards, but also to ensure continuity throughout our system for all of the users. And there were some glitches, as in all technology, as we started to move through that process. We have worked through all of those. All of the testing sites that were submitted in the old system or transitioned that have wanted to transition into the new system have done so. We are also continuing to do additional outreach to locate additional testing sites because it's always a need. Sites come and go periodically for many different reasons. And so we're always trying to get additional regional test sites. As of right now, as I put in my testimony, we do have 18 regional test sites and 55 in-facility test sites across the state of Pennsylvania. And we're continually working to entice additional sites to come on board. There are requirements for them to become a site. They do need to have specific equipment that is required by federal law and the exam to make sure that we are up to standards and in compliance with all of those items. There was questions about the virtual skills program. So we do have a virtual skills program that we are developing. We have piloted it in a couple of states, and through those pilots, we have determined things that needed to be changed, adjusted, tweaked from both a technology standpoint as well as a process and program standpoint to ensure that we are not only in compliance with the federal regulations and OBRA, but also any state rules and requirements that may affect it as well. So we are just about ready to release our kind of second version of the technology piece of it and then start new pilot programs. I'm aware of UGA that does their online testing as well, or their virtual skills testing. Theirs is more of just a Zoom platform. Ours is a little bit more enhanced, has some AI technology, has the ability for the evaluator who is an RN and licensed in the state of Pennsylvania as required by both state and federal law to really be able to see all aspects of the skill to ensure that the candidate is doing it properly. Another item that we talked about, let's see, where else? Cancellations. So I know that there was a question about the cancellations. Sorry, about the number of cancellations that have had happened. So we have reduced cancellations significantly since the beginning of the year. There were some scheduling issues. There were some technology issues. We were able to get them all resolved. And from January through April, we only had 218 exams in the state of Pennsylvania. But from May through the end of June, we have 102 exams scheduled. So we are steadily increasing the number of exams, the availability of the exams, and the ability for candidates to register for the exams. We've also adapted our evaluator process just a little bit. So previously we had only part-time evaluators, and we had a lot of part-time evaluators. And one of the things that we were noticing is that the part-time evaluators are not enticed to work as often as we need them to. So we have gone the direction of some full-time evaluators. So previously we had part-time evaluators, some of which under the old ownership and old process were only required to work one event per month. And so we have really changed that process. Now we have 3 full-time evaluators in the state of Pennsylvania. These 3 full-time evaluators work 5 events per week as opposed to per month. And they are increasing availability steadily. And so as we see an increase in availability and an increase in our available workforce, we have been trying to identify where now we have to get more regional test sites, and then do we need another full-time evaluator to accommodate that? So I think I touched on the main concerns that I have heard so far, but I'm happy to answer any additional questions that you have.
Thank you. So we heard you're under a remediation plan. I mean, are those the, you know, what specifically is in that plan? I mean, you may have outlined some of what you're talking about here, but.
Yes. So as mentioned, there are several different agencies. And so the different agencies all kind of are looking for different information. I don't have it up in front of me at the moment, but there are things from the state agencies wanting to really understand on a very granular level our processes and procedures. And that's the majority of it. They really want to understand how we do every step of what we do.
Well, having a remediation plan would indicate that there's issues with what you are doing. So again, these are the things that I've spoken on. So the number of testing events and availability, how we procure nurse aides, how we determine when we need nurse aides, where we need nurse aides, how we ensure that there's availability for candidates within the 100-mile radius, which is what is our contract with the state. So it's those types of things where they want to understand exactly how we are doing what we do to meet those criteria. And what's the time frame to meet those criteria?
So each criteria has different timeframes. The last item is the end of June, but the majority of the items are due before the end of this month. The things that would be the end of June are things that need approval from their side, and then they have to be worked into the technology on our side. And so there's a little bit of back and forth on some of the items to make sure that OLTL or DOH has done their approval and their, this is what we'd like to do. And then we integrate it into our system, which from a technology side could take a week or 2 to complete.
Thank you. Chair, Madam.
Thank you, Chairman. Thank you for your testimony. Understanding that you are under a directive, remediation directive, and you have changed ownership, I'd like to talk about, there were some scenarios and some testimony that we got regarding candidates traveling hours for a testing site, checking all along the way to make sure that was still happening, getting there and finding out that the person testing them just didn't show up and there was no communication. And then trying to follow up with customer service to get a new test date and to be told several different things by several different people, and then getting another testing date that is 6 hours away from where this person lived. How quickly are we fixing that? And are we particularly taking care to train people in customer service? Because candidate, credentia, amicable relationship. It seems kind of divisive and kind of like the candidate who's trying to get tested to fill the, to be able to do this work is having to fight just to be tested.
So again, those were the previous issues that I was speaking about. So at the beginning of the year, we were struggling to get not only the test sites and again into the new system. They didn't realize they had a test site or they had a test date, and then the evaluator didn't show up. So we had some challenges at the beginning. And so those are the things that we are working to fix, because I was a CNA at one point in my life. I completely understand the struggles that go along with this process, and the type of candidate who is taking this process, who is doing this training and this testing. So I completely understand where they're coming from. And that was one of the things that we really right off the bat decided these needs to be fixed as soon as possible, was making sure that all of the communication on our end from a technology perspective and with the individuals, right? Because we're coordinating the candidates, the test site, and the evaluator. So coordinating the three, where was the gap? Where was the concern and the issue? And then fixing those pieces. And as I said, now we have having the full-time evaluators significantly helps because it's a much more direct communication. They're given less of an option and more of a directive. This is the location that you're going to, and this is where you're going to test, and this is what time you need to be there. And then again, having the test sites, we've made updates and enhancements to the system that really allows them to have a better process, putting in their test dates, viewing what test dates they have, how many candidates they have scheduled, who's the evaluator, so that they know who to expect the day of the event. Our cancellations have gone down significantly. We've only had 7 cancellations in the last 4 months that were related to an evaluator. And those are the ones that you're speaking about. Those were the early on ones that we really struggled to get coverage for and coordination with. But those have improved significantly, and we have not had any cancellations over this last month. So I'm very happy to report that.
Okay, I have one quick question. If you've had 7 cancellations in 4 months, do you think maybe you need more than 3 evaluators?
No, ma'am. So those are our full-time evaluators. We also have an entire group of part-time evaluators. So our part-time evaluators work as needed, kind of if you're familiar with nursing, kind of a PRN option. They can work when they want, where they want, and they pick up events. The full-time evaluators work consistently at mostly consistent locations. We prefer them at regional test sites because they can have the most number of candidates at one, or the most number of candidates who don't already associate with an INF. When you're an INF, you test your own candidates. And so when you're a regional test site, you don't have the singular place to go. INFs have a little more control over when they test. My students graduate on Thursday. I'm going to have testing in 2 weeks, and all my students are going to show up at the same time. And if there's candidates who don't have that capability, they're not associated with an in-facility testing center, it kind of leaves them out in the lurch. And so we want to have as many regional testing sites available for them so that those candidates have some place to go to test in a timely manner. We also have the issue with if you have an INF and you test and you fail, now you need another testing site so that you can retest. And so we want to make sure that those candidates have opportunities as well.
Thank you.
You're welcome.
We obviously are coming to a conclusion, but I would ask at some point from our agencies that we get some evaluation. And it is concerning that it's, doing a remediation plan, that there are multiple agencies engaged, that there needs to be kind of a holistic response and evaluation. So it is concerning to have a remediation plan that's being evaluated by more than one agency and to hold Credentia accountable. So I mean, we can talk about that as we leave, but I think if both committees can be informed by the deadlines of what the status is of those remediation plans, I think that would be very helpful to us. And I'm going to ask if we can conclude with Chair Rapp and then Chair Representative Gleim. We really are at the
Pushing it.
at the end of our hearing.
Right.
so.
I just, I'm from Cumberland County, and I have 10 long-term care and nursing homes in my district, so I'm very concentrated with elderly, and this has been a problem for many years. I was just wondering, are you in any type of remediation plan for processes and procedures in any other state other than Pennsylvania?
We are not.
Okay, thank you.
You're welcome.
Chair Rapp, sorry.
Thank you, Mr. Chairman, and I do appreciate the time our testifiers took to be here and answer our questions. And typically, at the end of a hearing, we have, even more questions. But there are clearly many issues that need to be addressed, and having this conversation is an important first step. I'm sure we'll all be taking a closer look at some of the suggestions presented here today to find solutions for our aides. And I agree with you, Mr. Chairman, that there needs to be more discussion with the state agencies and their involvement in all of this. And hopefully, maybe we can have a follow-up, with this issue. But I thank you, Mr. Chairman, and all of the testifiers here today, and it was nice to be with the other committee chairs as well. So thank you, Mr. Chair.
Thank you. Let me join my co-chair in thanking all the testifiers today for, I think, a very informative hearing, and also to my fellow chairs, Chair Madden and Chair Menser, from the Aging and Older Adults Committee. With that, I think we will conclude this hearing exactly on time. Thank you.